Okay, so here you can talk to brightness. Let's put in the screen. Yes, here we go. Now it's fine. So here is your tibial nerve. See that? They're totally separate components. Here is your tibial nerve. Here is your common peroneal nerve, right? Currently, they are in one sheath. It's called the Vlocus sheath, right? So they are currently inside the Vlocus sheath, and they're together. As we go distally, they'll start to split apart. Here is also a vasa nervosum. It's a artery supplying the nerve. Sometimes it's there. So you can also appreciate that. So really what please I'm a bit tilted, and that's why it's so now that's pretty good.
See, okay. There is present as a single component. Now if Dr. Umair moves the probe distally, they will split.
Now just watch as I move the probe distally. You'll see this, watch this common peroneal nerve. Watch this common peroneal nerve. Watch it leave. Watch it leave.
Moving laterally.
Watch it, it's going to leave and it's going to wrap around the head of the fibula, all right? And that's the lateral side again, see? It's leaving, and now as we follow it back down again, it's going to join back with the going to join back with the tibial nerve, okay? You can't see the arteries, and right now, I think it's also not so important to see them. The vessels are below here. So this is the vein. I don't know if you can appreciate it. The large vein, yes, you can appreciate it in the screen, all right? This is a large vein, okay, compressed, okay, compressible. This one here is the artery. If you are confused, you can apply color flow, and you'll see pulsatile flow in the artery, okay? I've identified the artery. So superolateral to the artery is the vein. Superolateral to the artery is the vein. Superolateral to the vein is the nerve, okay? So the first nerve you see here, this is the tibial nerve. It's actually very bright on the screen over there. Let me see if I can make it easier for them to see. All right, so this is the tibial nerve. All right, so you see one nerve. Is this a good place to block? No, it's not, because you can't see the common peroneal nerve, right? You have to always search for the common peroneal nerve as well. So this is not an ideal place to block. I've seen some people just come in from lateral to medial here. Sorry, that's medial to lateral from this side, from lateral to medial here, okay? And they have not identified the common peroneal nerve. What problems can arise is that as you are coming from laterally, you will see the common peroneal nerve, and I don't think anybody will appreciate it if the patient has a foot drop. So always first identify the common peroneal nerve, scan up and down, scan up and down. You see that? Scan up and down. This is again leaving, splitting, they're joining again, they're splitting again, they're joining again. The big difference is in the popliteal sciatic nerve block, you cannot place your ultrasound just like this and see the nerve. I'm placing it straight. What am I doing now? What's the right way to do it? Tilt it towards the foot. Tilt it towards the foot. I'm scanning like this. I'm not scanning like this. This way you will never see it, okay? You scan like this, towards the foot. If you scan towards the foot, the anisotropy, that is the nerves will be able to be seen much better because they're actually traveling in a curved direction. They're trying to come upwards like this. So keep your probe tilted towards the foot and then scan like this. Okay, now I've placed it straight. I've placed it flat. I can't see anything. Well, I actually know where the nerve is. I can see it now, but I can't see anything. Now I'm not moving anything. I'm just tilting the probe towards the feet. Watch as that nerve shows up. Watch as that nerve shows up. Perfect. Tilted away from it. My probe is straight direction, okay? Everybody thinks straight direction is the only direction. That's totally wrong. In every nerve, there is its own direction. I can't see it. I'm not moving the probe at all, just tilting the probe. The nerve has appeared like magic. We couldn't see it earlier. We couldn't see it because we're tilted away from it. The angle is not at 90 degrees. So the ultrasound probe, the ultrasound beams have to hit a nerve at 90 degrees to show a good image. This is why a lot of people struggle with the sciatic block, is that at this point, I can't differentiate it from the muscle. It all looks totally the same. Although the sciatic nerve is one of the brightest nerves in the human body, tilted. Look at that. Perfect nerve. See that? So I have now tilted, and I'm actually almost, my probe is almost horizontal to the leg. It's almost flying like Superman. That's how I'm seeing these two nerves. Okay. So I think that's it for the sciatic. As far as the muscles go, this is the on the medial side is the semimembranosus and semitendinosus muscles. Okay. And on the lateral side is the biceps femoris muscle, which you can't see very well here. It's this one, this biceps femoris muscle, right? So I think they don't really matter so much, so long as you just put your probe in the popliteal fossa. Now see, everything is just a mess. I can't see anything. I tilted my probe. Suddenly I can now appreciate the nerve. Okay, so now I'm scanning up and down with a tilted probe, and now I can see the nerve. Okay, so I guess that's it for the popliteal.